Our guest for today is Dr. Biswajit Panda. Dr. Biswajit Panda is a renowned dental expert with a passion for delivering exceptional patient care. Dr. Panda will be sharing his expertise on the latest advancements in dental technology, treatment options, daily dental care routines, insights, and much more. So stay with us and let's get the episode started. Hi, Dr. Panda. How are you doing?
Hi, all good, all good.
So first thing, we'll start with a very controversial statement, or which is proclaimed around the world, or which the other doctors say, or sometimes normal individuals say, the dentists are not real doctors. So what is your take on that?
How horrifying. Dental doctors, but it's a bitter truth. Definitely, we also hear from our colleagues, from patients, from common man, but it is absolutely a myth. You will understand because we are into dentistry. Definitely, lot of medical emergencies do happen on a dental chair. It can happen with you, but nobody's known. It can be any anaphylactic reactions from the injections we use. It can be any cardiac arrest from anxiety. It can be hypoglycemic shock. It can be hypovolemic shock. It can be any bleeding, excessive bleeding, hypovolemic shock. It can be any medical emergency, angina, anything can happen. But on that time, on this scenario, only your dentist is your savior, or a medical team or a trained dental staff is present there. Definitely, they are trained for CPR or other medical emergency, how to handle a medical emergency. First of all, a dental clinic needs to have all those emergency drugs or life-saving drugs, oxygen cylinder, which is a basic requirement. These are some basic requirements which should be present in a dental clinic, because the emergency can happen anything. And according to you, how I have a story to tell. When we are trained as a medical professionals, once in a while, recently in a shopping mall, in our shopping mall only, a small boy, just swallowed the food and it got stuck in the windpipe. So he was coughing, he was gasping for breath. I was the person who did a maneuver. We hold the boy from behind and just press the stomach, and this coughs out.
Okay.
The boy literally coughed out that, and he was fine. And it's an emergency procedure. If I'm not trained to do that, who will save?
So how did you think this myth developed over the years?
This is because dentist doesn't have a stethoscope around the neck. That may be the myth.
Right.
But definitely, when it comes to the battlefront, definitely any medical practitioner or say so-called medical associates, our staff, the trained assistants, they are all educated to save a life, which is very precious, and it has to be in fractions.
Right. So with the world now rapidly advancing towards artificial intelligence, how do you think AI has a role to play in the field of dentistry?
See, dentistry has changed from basic that earlier we used to go to a dental clinic, used to smell bad, the whine of erotas, the myth that if you go to a dentist, people will pluck your tooth only.
Yeah.
So all those myths are gone. Nowadays, it's more of a pleasant atmosphere or a wow experience kind of thing. You enter a reception, you are that handwritten things are gone, tabs have come in, the softwares, the CRMs have come in, where you get the appointment confirmations, appointment SMS, no disturbances. You get WhatsApps, confirmation appointments I'm talking about. You get the bills over the phone. These are some extra things, but definitely music, good smell comes into presence. The experience from the treatment coordinator, you are counseled well, you are told about the procedure, how you are going inside, what is going to happen inside. So all those things. Apart from that, the gadgets have changed. The gadgets are like in our clinic, what we use, which is a special gadget for diagnosis. We have an in-house CBCT machine. CBCT means cone beam computer tomography. It is the CT scan of the teeth or the jaw. So this is the exclusive machine which we have in our clinic, which is used for diagnosis. This diagnosis gives you a 3D structure or a 3D image of your whole jaw, which is may not be significant for you, but very much significant when we as an implantologist placing implants on daily basis or working on the patients. It gives you a 3D structure. Where is the nerve? Where is the planning? How much should be the length or the width of the implant? How far it is from the vital structures? So it helps us in very planning stage. So this is CVCT. Another equipment we have is a conscious sedation machine. This is a machine called sedation machine. This machine, what we are using nitrous oxide and oxygen. So with this nitrous, we can achieve more painless anesthesia and all. The anesthesias we are using are fine needles, but talking to AI, that is more of we are using in case of aligners. In case of aligners, we have another machine called scanners.
Okay.
This is known as intraoral scanners. So with these scanners, we are scanning the whole mouth. Those days are gone when you put the impressions in the mouth, patient gets gags, and it's a messy thing in the unit. Those days are gone. What we do is we do dental scans, which is a high-end camera, you can say. It takes the whole scan and the whole records. With this digitization, we can send it to our labs immediately. That PDF file, the STL file, which what we get, we can send it to any of the labs, stating it be in Kolkata, outside state, outside abroad, wherever we wish to. And the work, the dental crown or the prosthetic work which is to be fabricated can be fabricated immediately.
Right.
Immediately. Whereas before we used to send it by courier, it was to reach there. If any modification, then again you have to send. Nowadays, the technician, the Germans are best in our dental technicians. So he can check if everything is gone, he can go green tick and then we can send the file.
Right.
So that is AI. The aligners we are using, that is AI based aligners. What happens usually in this scan with the software, with the AI, we can tell this is aligners are something which we are using when the teeth are rotated or any malformed teeth. This is the most modern technique of treating a malaligned teeth.
Right.
Okay. So aligners, there are sets of aligners basically to treat a.
So these are basically, earlier we used to call them braces.
Yeah.
So if you have to just tell us in maybe one line, okay, what are braces used for?
See, braces are the ancient methods, rather proven methods. We are still using braces. This is the gold standard, no doubt about it, to treat malaligned teeth or malocclusion cases.
Okay. And how are braces different from, say, aligners or invisible aligners? We hear these. Now, how are these different?
Yeah. So this is the modern thing. What happens in braces, it is under the dentist or the orthodontist, the specialized people in the domain.
Okay.
Orthodontist or dentist to be treated. They are under the control of the dentist or orthodontist.
Okay.
So what happens is with this AI, the aligners comes in set. So the AI can tell you how much degree rotation will be there in, say, aligner has to be used or weared for, say, 20 hours plus for a 2 weeks time, the first aligner.
Okay.
The second aligner has to be same, say 20 hours per day and say another 2 weeks. So every 2 weeks, there is some changes in the teeth alignment. So how much, say 15 degrees, say 20 degrees, that AI will decide. And accordingly, the next aligners will be fabricated. The first aligner, the second aligner, third aligner, fourth aligner. So if the first aligner, if you are not wearing it for 20 hours for 2 weeks, the second aligner won't fit because this is AI generated beforehand only.
Right.
So that won't fit only.
Right.
So, but if you are rigorously using it with the speculated time, then it can fit. Then the second aligner, then the third aligner, the fourth aligner, automatically the treatment will get over at perfect stipulated date and time.
Okay.
Because as AI has decided. So these are some disadvantages of AI.
Right. So tell me, unlike braces, you can't see if your person is wearing aligners.
Yes,
right?
definitely. We can't see.
Okay.
And the advantage is if you are going for a media person where camera is zoomed, for a celebrity patient, for somebody who is oftenly partying, you can just keep it in a box, and then after the
once you're back, okay.
That's the advantage.
So suppose as you said, suppose somebody is at an event and they are not using the aligners for 2 hours,
no problem.
Or say about 4 hours,
no problem.
So then if they go back and wear it, so that
no, that is not a drastic change. The teeth moves very slow. So if you are not wearing for 2 days, then there's a problem, but
Okay.
not in for hours.
And between braces and aligners,
Right.
which is more painful?
See, braces are not painful usually. What happens is when your teeth moves, that may initially it may gives you a pain and a discomfort. With braces, what happens is usually your this tongue get lacerated or the cheeks get lacerated. That's the problem. That's
Okay.
maybe annoying in the initial days, but once you are used to it, it is not.
What about aligners?
Aligners are simple as the boxers use. It's a simple. It is prefabricated and it is customized made. So no,
there's
refitting.
there's no
No,
pain
no,
or
no, nothing,
cut off the
nothing,
cheeks or the tongue.
no chances. No
Okay.
chances. No
Okay,
chances.
okay.
But aligner is absolutely under dentist supervision.
Okay.
It should be under dentist supervision.
Okay.
Whereas it is AI created, but it should be under dentist or orthodontist supervision, but not DIY or some online aligners.
Okay,
That is not recommended from any professionals.
And in terms of the expense, if you can quickly give us an idea of the difference between spending for a braces and spending for aligners.
See, aligners earlier it used to be expensive because there were only few companies who were giving results and all were imported things. And now the Indian manufacturers have come in. So aligners have dropped in. The costing of aligners have dropped in. And it absolutely depends on number of aligners we are using. And that will absolutely depend on the scan or on the AI.
Obviously. No, for example, there's a person with a certain deformity in the teeth.
Right.
If they suppose choose braces, what will be their cost if they choose?
See, braces in our city usually is say 30K to 60K. It varies from dentist to dentist. It is a period of say 1.5 years treatment plan.
Okay.
Whereas in case of aligners, it just starts from approximately 40-45K to it can go up to 2.5 lakhs also.
And time taken?
Time taking is almost same.
Oh, it's almost same.
Almost
same. So it's not. So basically, it is not
aligners, like aligners are done in case of mild deformities, some little twist, some little. Whereas aggressive cases of aligners are possible, but definitely it is going to take time.
Okay. Is there any particular case, like suppose an extreme deformity where only braces are possible and aligners are not possible? Is there something?
See, that is the dentist's call.
Okay.
It is not chosen by patients.
Okay.
It is the dentist's call. If he wants to go by the. See, what happens is these aligners are more liked by school-going candidates. So what happens is if they are not responsible or the treatment is not, if the person is not wearing for the stipulated time, say 20 hours for 2 weeks, I told you the next aligner won't fit.
It won't fit. Right.
So if you have taken it from an online company, you keep calling the customer service. No one will be there to answer.
Right.
Whereas if it is done under dentist supervision, a dentist is responsible for it.
Correct.
And definitely there will be reminder calls. Are you wearing it? Are you checking? The checkings will be there.
Right.
So that's why it is advisable to get it done from a trained orthodontist or a dentist.
Right. One of the most common, questions that are there is that how many times a day should you brush? From the expert, what is your opinion in it?
It's always suggested to get the brushing done twice.
Okay.
It is after breakfast and after dinner.
After breakfast and after dinner?
Yeah, nobody knows that, but usually we do before breakfast for freshness. But it's no point brushing when you are brushing at night post dinner. You are not eating something before bed, before breakfast. So it's advisable to what is the doable of brushing? What we do is we clean the teeth. The brush cleans the plaque. So if you are not eating something, if nothing is deposited in your teeth, then why do you want to brush? See, brushing is not for freshness. Brushing is to be done to clean the bacteria or clean the plaque. So it's always advisable to brush after breakfast.
Right. And what is your take on these, mouth washing liquids that are there, fluids that are there, and the mints that we use also?
See, mouthwashes are used for freshness.
Okay. Okay.
It has antibacterial properties. Some of the prescribed mouthwash, what we prescribe, see, usually we use the mouthwash which is available on
Readily in the market.
available
Yeah,
market
yeah,
or
yeah.
from the advertisements.
Yes.
But when it is prescribed by a dentist, definitely it has got some antibacterial property,
Correct.
which is to be used on the prescribed time, say 2 weeks, 3 weeks time. If you have gone from under any surgery, there is some healing mouthwashes. There are some medicated mouthwashes like anti-sensitive mouthwashes are prescribed by us. So every blue color liquid is not same. So
Right.
so it is to be prescribed by the dentist. And if you are using it on your own, then it has to be for your freshness.
Okay.
So that doesn't
Okay.
means that you are using as an alternative of brushing. You can use it in your regime, but it is not an alternative to brushing. First of all, it has got antibacterial properties. Chlorhexidine is the most important ingredient in a mouthwash, which has an antibacterial property. We can use, but excessive use of mouthwash gives you stains.
Oh.
So it's not recommended to use mouthwash twice daily, every day. It's not.
And what about usage of mints, as I said?
Mints, chewing gums you're
Yes,
talking
chewing
about?
gums,
Chewing
yeah.
gums, definitely sugarless chewing gums are available. That is good because
Okay.
it creates more salivation in your mouth, which is helpful in swiping off the bacteria. So more
Okay.
salivation. So chewing gums is good. Sugar-free chewing gums is
ones
good.
are preferred. Okay. Another very common question is, how does cavity, form in a mouth? So that's my first question, and there is a related, but I'll first.
See, cavities, what happens is when we eat something, the bacteria, it combines with the food particles and the saliva, which creates a thin layer over your mouth, over your teeth, which is known as plaque. Okay. So as the plaque is formed, when we are taking something, sugar, starch, carbohydrate, whatever it is, those bacteria gets feed from those sugar.
Okay.
Okay. That bacteria is getting the food from the sugar. Those bacteria, then when it is getting the food from the sugar, it creates acids. Okay. So acid created from the bacteria gives or irritates the enamel, the hardest structure of the tooth, and this leads to black holes, which is known as cavity.
Okay. Okay.
This acid is dangerous. The bacteria creating those acids creates a hole in your tooth, and the hardest structure of the tooth, enamel, is harder than your bone. Tooth has three structures: enamel, dentine, and the pulp or the nerve. So the outer layer is the hardest structure, which is the enamel. So that gets dissolved with that acid. So definitely then a cavity is formed. When this cavity is not treated or not attended, this cavity will grow below only. So it will go to the next layer known as dentine. And if not treated or attended, then it will go to the below layer, which is known as pulp or the nerve. Then only you will start getting pain.
Right. And how do you prevent this? Like after happening is obviously you go to the dentist, fill your cavities, but how do you prevent it so that cavities hoga hi nahi?
See, lot of salivation should be happen. So every time you should rinse your mouth.
Okay.
Chewing gums are good.
Okay.
Eat some non-sugary intake, what we say. Because if we take sugar foods or the aerated drinks or some sticky foods like sandwich, say chips, pizzas, whatever we eat, that has got starch in it. So that is also getting into breakdown into sugars. So sugar supply, if the bacteria is not getting that food, the sugar, so it will not grow. So that is one way to prevent a cavity. We can eat fibrous food, fruits, sugarcane, guava. These are some fruits which help in irradiating the plaque.
Right.
Less sugar intake. If you are taking the sugar also, then rinse your mouth thoroughly. Some fluoridated toothpastes are available or fluoride layer which protects your tooth from the cavity. Those are required. So these are few and any food which are having more of calcium, you can say.
Okay.
Milk, any calcium rich food will help your teeth.
Right.
And vitamin C rich foods like fruits, lime, orange
Orange.
juices,
Right.
which will help with the gums, for the gums related thing.
Acha.
So vitamin C rich fruits.
Right.
So these are some common foods
Right.
which can help your teeth.
Okay. So
Any food, see, we take amla, we take almonds for good skin.
Okay.
We take other fruits. So whatever is good for your skin, your scalp, your face,
that is also good
for your teeth also.
Okay. So that means that's why our parents or old people, they used to say कि मिठाई कम खाओ, chocolate कम खाओ, नहीं तो दांत में कीड़ा हो जाएगा.
I don't advise. I don't advise. No, I don't advise.
अच्छा.
Because kids will have chocolates, and if you say them no, then also it's a bad thing. So I always advise to have chocolates. Whatever you want to eat, but brush after that or rinse after that. The problem is the food or the chocolate or the chips, whatever it is getting stuck in your teeth. It's getting deposited.
And when you say rinse, you just with normal water.
You can always rinse. You can brush. If it is more sticky, you can brush. It should not be there on your tooth.
Understood. Okay.
For longer time.
Right. So there's also a saying, we have seen people mostly in the semi-urban areas or the rural areas, that they use a particular stick in the morning for their teeth. Datoon. So, and again, myth has it that it is even better than normal brushing and toothpaste. So what is your opinion?
No, it's a myth. See, Datoon is usually from babul or neem tree. So definitely neem has got good properties also. Basically the neem juice has got good properties. The bitterness and the other things are good for your cavity or bacteria. Bad for your bacteria. So it has got antibacterial properties also, but the neem juice should be there. So the correct way is more important. The question you asked, it is not alternative to the brushing.
Oh, it is not. Okay.
It is definitely no alternative to the brushing. But what I recommend is this kind of neem datoons can be incorporated in our daily regimes. Daily oral hygiene regimes, it can be incorporated to get an added effect, but it is not an alternative to the brushing.
Right.
So usually what I recommend is any buying from online or somewhere when it is a dry stick, it doesn't help. Usually it should be from a fresh branch of the tree. Cleaned, hygiene should be maintained, it should be washed. Cut it into long sticks. First chew it, the juice should come out, then you brush, then you cut that and keep it in a refrigerator.
Okay.
You can reuse the thing. The juice is more important, the freshness is more important rather than using a dry. And it is, as I told, it is not an alternative to the brushing. Never it can be alternative, but it has some good properties. So we can definitely incorporate in our daily oral regime. Say once or twice a week you are doing it. So it's a good for health.
And also,
mental health.
I had read somewhere, and please correct me, doctor, if I'm wrong, that fluoride, it is not used in US, or it is somehow in the toothpaste in the US. But in India, it is used. So is this correct, and why, if it is correct?
See, fluoride, if it is the ppm level, if it is taken on, if you swallow a toothpaste on a larger quantity, maybe with the kids, it is harmful, definitely. But fluorides, any toothpaste which has got a research-based background, any multinational company which we recommend, definitely has got 1000 ppm of toothpaste. You can just turn over the toothpaste leaflet and you can see how much fluoride it has. Fluoride is good. It definitely puts a layer on your teeth and definitely it prevents cavities. It is always recommended for childhood or say 5-6 years of kids to use those kind of fluoridated toothpaste. In clinic, what we do, we put a fluoride layer. We do fluoridation treatment for kids where we can prevent cavities. Any kid very prone to cavity. So then we do such fluoride applications clinically. We apply fluoride on the teeth so that a reparative layer or a protective layer is developed over the teeth and the kid don't get cavity. We do often in clinic. So that fluoride in mild form is present in the toothpaste. So it's always recommended to use a fluoridated toothpaste in
kids. The fact that it is not used in the US and all, is it true or is it false? And if it's not used there, then why is it not used there?
They have different standards. Our oral hygiene regime, our public health dentistry is different.
Totally
different. Indian scenario is always different.
coming back to cavities again. So, what is what does your teeth? How does your teeth react to, say, pan masala, gutka, or smoking?
See, teeth is the very hardest structure, as I told, very hardest structure than your bones. So enamel basically. So definitely gutka is not recommended. It is written in the packet, boss.
Itself, yeah.
Any smoking is injurious
Yeah.
to health. Gutka is injurious to health. But definitely, it is endorsed by the celebrities. Unfortunate part of
Yeah.
our society.
Yeah.
Sachin Tendulkar is one of the celebrities who did never endorse this kind of. But with due respect, other celebrities are doing that. The actions is more important. You are selling ilaichi or pan masala, doesn't make sense. But the uneducated class is definitely taking. They are your heroes.
Exactly.
So if your heroes are doing that, so definitely it is incorporated in the society. It is the bad part of our society. I definitely condemn this, but it's a part of the game. So this kind of tobacco chewing is definitely injurious to health. It can lead to precancerous lesion, which is diagnosed by dentist in their clinic. If undiagnosed or untreated, can lead to cancer. Cancer means no answer. And cancer, if it happens, the life is ruined of yourself. Financially you are drained, emotionally you are drained, physically you are drained. You, not only you, your family is also drained. Cancer, if then it can lead to operations, it can lead to radiotherapy, it can lead to chemotherapy, it can lead to rehabilitation, it can lead to death. If not, small injection incisions, maybe hemiglossectomy, half of the tongue is cut, half of the mandible is cut. More if it is towards the lymph node, then commando operation, half shoulder, you can't move your shoulder. Lot of things. Right. So why to
go yourself in that direction? Yeah.
But regular basis, what we diagnose is OSMF case. OSMF means oral submucous fibrosis, which is a precancerous lesion. In that, especially what we get is the mouth opening is limited. The bands, the cheek has got fibrous band due to gutka chewing for the longer period of time, and you are not able to open your mouth. So definitely a patient is having pain and other things, then we do give lesional injection, a cocktail injections we give, so that and with the physiotherapy or wide opening, forceful opening, you can say, definitely we are getting results for OSMF cases. Right. And it's important, our city or any other clinic, it's important to get pre-cancerous centers rather than having a cancerous center, cancer rehab centers. It's wise to have a pre-cancerous. So in with help of Indian Dental Association and other organizations, we are regularly doing oral cancer screenings. Right. In private clinics, government clinics, everywhere we are doing it regularly.
For anybody who's young and who aspires to be a dentist, what are the top three government and the private dental colleges in India according to you?
See, there are numerous studies, not only studies, numerous things are coming out. Somebody tells I am the first time.
Exactly. But so according to you.
So there are a variety of colleges available all over Pan India. I come from a best college. I am from SDM College of Dental Sciences. It is in Dharwad in Karnataka. It is the top college. It is the 5-star accredited NAC college, definitely. NAC is a accreditation body. Yeah. So 5-star colleges are there. We have a lot of students coming from abroad also in SDM College of Dental Science. In private colleges, I am telling. Savita Dental College is a good college in private sector. Pan India, I'm talking about. DY Patil is a good college. Bharati Vidyapeeth is a deemed university. JSS Mysore is a good college. These are few private colleges to know. In North also we have Subharti Dental College, good colleges. But
government
college. No.
And what about colleges. Government?
See, in our city, if you want to know, we have Guru Nanak College of Dental Sciences. We have Haldia Dental College. We have Jain Dental College in Sodhpur. So these are 3 5-bed colleges we have. Right. And government colleges, definitely we are proud. Are Dental College, our city, is a very good college in the government sector. We have other government colleges like GDC Mumbai is there. One is Government Dental College Mumbai is there. Maulana Azad is there. These are few good government colleges to name. Lucknow, KGMC Lucknow is there. These are few good ones. But
And-
R. Ahmed stands out in our city, which is in our city.
Right. And suppose one completed his graduation and he started to practice.
Mhm.
What is the kind of money that one can expect to earn in his first year of working as a dentist?
See, any field requires internships. You
Obviously,
know those
yeah.
struggle days. You are reminding
Correct.
of me my struggle days. But that is everywhere.
That is
in
part and parcel.
Part and
Yeah,
parcel
yeah,
of every profession.
Yeah.
But I can assure you that it is a very good domain, very good branch, you can say. In case of medicine, if you are compared with the medicine, we don't get emergencies, and we don't get overnight calls. We and we can have our basic car, roti, bangla, and makan. So these are definitely expensive, because if a person is looking for establishing a dental clinic, definitely he need funds. But with over time, he can definitely, after practicing into hospitals or some senior dentist, definitely he can earn a good amount, a decent lifestyle.
Correct.
You can say.
We have often heard, from celebrities that I'm going for smile correction. So, A, what is smile correction? And B, have you ever worked with a celebrity or a famous personality?
See, smile correction, as you told, smile correction, correcting the smile is known as smile correction. In our language, we do smile designing, we say that.
Huh.
And nowadays, we are doing DSD, means digital smile designing. So, how it works, I will tell you. Any person coming into our clinic, the first questionnaire what we give is what you don't like about your smile.
Okay.
So definitely 1, 2, 3, 4, 5, 6 comes.
Okay.
Because everybody is looking on the selfie.
Yeah.
So any person coming to my clinic is prepared. So 1, 2, 3, 4, 5, 6, hand, it comes. So then I found out why you don't like this. The reason behind it, why this is like this. It is by birth or by any pathology or any gum problem or bleeding or twisted, broken, accident. What is the cause of that? Then comes the designing part. Now there comes the AI part. We take pre-pictures. There is a software where we can show you the expected post. Okay. So then again, the AI, we can scan. The scanned AI will give you all the defects. Definitely that is AI. It can't replace the human, but all feedback we get. Stipulated WhatsApp message we can get. It can be sent to the patient also. So pre-pick, post-desired pick we can get. Then we do the scan. We get the intraoral digital file.
Okay.
Full file. Now we can put templates. We have templates. We can put Aishwarya Rai, we can put Hrithik Roshan, whatever you want, or stipulated a feminine face, feminine look, the rounded. What we look into is the golden proportion. Golden proportion means the central incisor are bigger, the lateral is little shorter, canine is sharper, and the curvature, whatever we look at, that golden proportion we look at. So we can put templates, whatever you like or I like. It is referred to the technician. So technician plays a very good role, or a lab, dental lab plays a good role, which is a hidden part in our dentistry. We work with good laboratories, or the best laboratories in the world. Kolkata has got good laboratories. We work with Kerala also. We work with Mumbai laboratories also, because they do a lot of export work. It's a huge lab. Huge lab means they are female-oriented labs, like thousands of people working in the lab. And they do export quality, because Dubai, Saja, India is a cheaper country, so this kind of laborious work, good quality work at low price, everybody wants. So a lot of export happens from India. So we work with those kind of laboratories, and this is how then the work that comes. So we fit it in the mouth. We see, patient also sees. If both of us both of us on the same boat, then we cement. And once cemented, it can't be.
Is it painful?
It is not painful.
I heard somewhere that you have to extract tooth and all of that and make it.
No,
nothing.
No, not for smile designing.
Okay.
Smile designing, see, these are mild corrections what we do. Somebody's tooth is twisted, somebody doesn't like the color, somebody doesn't like the shape, somebody says the tooth is outside, or See, there is a lot. The patients, what I get, as you told, celebrity patient, I get a lot of celebrity patients from Tollywood, Bollywood, singers, musicians, camera persons, Bollywood, Tollywood. You can say judges, district judges, celebrities.
Okay.
I can't name them,
Obviously,
but
yeah.
definitely I do.
Yeah.
Politicians. So lots of
So there are no side effects to this?
no side effects.
Okay.
So see, any cosmetic changes
Hmm.
will give you a boost in your career, your personality, whatever you do. If you are camera friendly, you are a camera person, and your teeth is not looking good, it will be. In nowadays digitalized cameras, these cameras are like you can zoom
Yeah.
in whatever you want to see. You
Yes.
can. So that is not possible. That is not possible. And another class of patients, what I get is from district patients.
Achha.
And the social taboo, people not getting married due to teeth.
Oh, okay.
So this kind of patients I get, say you can say middle or lower middle class society, but definitely they do pay. ऐसा नहीं बोल रहा हूँ कि with regards to any class, but the taboo what I am more emphasizing is कि you have a bad shaped teeth and the girl is not getting married. Our interview is getting not cleared, or army people they get it checked. There is a calculation for army interviews. They have scorings 1 2 3 4 5 6. So you have to get 14 out of 20 to get qualified through the army things. So a lot of people comes in. So this is how we are doing smile designing, and we are getting wow results because of the labs, because of the AI. You can say people get convinced by the thing, and definitely celebrities and all. Every celebrity, maximum of the celebrity has undergone these things.
Right.
Another part we are doing is like which is required for serials, and recently Mr. Atanu Basu, famous director, came. I did it for Shashwatoda. He came for Achena Uttam, the movie. He needed a changeover as Uttam Kumar. So it was good. We oftenly get cases as people want Dracula teeth. Those things, those kind of cases.
But why do people want Dracula?
Vampire? How will you show a vampire in serials? I'm talking about serials and other things.
Okay. Has a procedure like this ever gone wrong?
No, these are processes usually which you can take out and
because often what happens with cosmetics, sometimes the lip job can go wrong. A boob job can go wrong.
Yes.
But with this, can it ever go wrong?
It can go wrong, but it can be rectified. It can go wrong, but usually not. If as we are doing it on a trial basis, if you don't like it, see how it goes wrong is day before yesterday I got a case from our district patient. The doctor has already done the procedure, smile designing procedure, but the teeth used, the quality of the tooth used from a very cheap laboratory, you can say. The doctor has done the good job, but the expectation was was not meet. The expectation was patient was there, and the doctor has done the smile designing, but the quality of the teeth and the profile and the things is from the very district level local lab.
Right.
The desired result was not obtained. The doctor had pasted it also. So now the patient came running the next day. I didn't like, the doctor fixed it. Then why did you get it fixed? So again, I had to undo the procedure. I had to do nothing. I just fabricated the teeth from a good class laboratories. So there comes the difference. We do veneers. Veneers means, as you know, sun mica or the veneers of the furniture.
Yeah.
So same way we put thin layer of veneers over your teeth, over the desired smile area, and it is pasted. So this is how smile designing works.
Right. So 2 more questions before we move into our straight or twisted section. So I suppose I'll be giving you, say, 6 brands, okay? And I know you can't side as a dentist, but still, if you have like a preference towards something or to the general public, so you can tell that. So Colgate, Close-Up, Pepsodent, Sensodyne, Dabur, and Patanjali.
Okay.
Your recommendation and why? Or your not recommendation and why?
It's a risky question. So see, what we recommended is any company, the first 2 companies these are multinational brands.
Yes.
And we are hearing this from ages, from our childhood, your childhood, my childhood.
Exactly.
The same company.
Even
we
when we
hear.
go to a shop, we name the brand.
We name the brand.
We don't say ki, give us toothpaste.
Give us toothpaste. So definitely multinational company, they have got a research background.
Right.
And they sell their product on research by the dentist. Not only I am the only dentist, it is worldwide dentists who are doing the research according to their area of things. And there is reports are coming and research background according to the things are modified, the ingredients are modified, things comes like that. So definitely that is a good brand. But the ingredients, you have to be wise these days. You can't go with the company.
Correct.
So you can see the leaflet, how much fluoride it has got. Does any other brands have that quantity of fluoride? Fluoride is a good ingredient of a toothpaste. Harm with that toothpaste is the content called sodium lauryl sulfate. It's the soap basically, which does the cleansing action. But that is in a very small quantity which does the cleansing action. But now if you say ki, that will get absorbed if I keep it in the mouth, you can contradict me. So that do happen, but that is a very minimum amount quantity.
Right.
So that is a bad ingredient of a sodium lauryl sulfate. So another toothpaste which you have named, those have got Ayurvedic background and they are sold directly to the customers on advertisement basis. No dentist, nothing. That is a bad part. Quick rise of the company. They are sold by, but their ingredients definitely Ayurvedic properties. If you see the leaflet again, long or our long is a very good content.
Yes.
Any other Ayurvedic content, the content is very good. But damn, that got have very good abrasive. The particle size is very important for a toothpaste. The toothpaste abrasive content. See, we do use scrubbers, right? That has got ppm. You know how hard the scrubber is. Men, women, different scrubbers comes. The same way the toothpaste has got abrasives. That abrasive content, the size of the abrasive, the particle size is the main important thing. If you have a bigger particle size in this kind of toothpaste, it will work better for you. My patient comes to us, then they tell ki those toothpaste, the Ayurvedic toothpaste are very good. Doc, your toothpaste doesn't give results. That toothpaste I am using it since long. It is giving, definitely will give you results because the ingredient is very good. But on the same time, the particle size is higher side. So particle size will damage your teeth. If you are scrubbing your utensils with a steel jali, definitely it will clean better than a Scotch Brite. So why you use Scotch Brite for cleaning? So this is there. And another toothpaste you named, that is a sensitive toothpaste, that is to be used under supervision or when prescribed.
Right.
It is named as medicated toothpaste. It can't be used over the counter.
Okay.
First of all, if you are using it, then you are not getting the symptoms. And there are various methods of using the same toothpaste also. Suppose the medicated toothpaste, it is to be used or applied with the brush and you should not rinse it after, say you should rinse after 15 minutes. The toothpaste should be applied or kept applied. The medicine, it has a medicinal property. That medicine should be there on your tooth for a longer time.
Right.
Then only it makes sense. If you are brushing and you are washing again, it doesn't make sense to use a medicated toothpaste.
Right.
So the take, which toothpaste to use, as you are asking, my suggestion would be to use a toothpaste. You should use a toothpaste not for a longer time.
Keep changing
basically.
Okay.
So definitely you are not exposed to the bad part for a longer time.
Understood.
So my take would be that.
Right.
And definitely how you use the toothpaste and how much quantity you use the toothpaste, that is also more important.
Right.
You should take the toothpaste a peanut size, you can say. And the toothpaste has to be used perpendicular and it has to be pressed inside the bristles. The toothpaste should be pressed inside the bristles so that it doesn't fall, and the whole amount, as we see in advertisement, toothpaste with a long tail, that is not recommended.
Right.
Peanut size inside the brush, and then you keep brushing.
Okay. And what is the correct way of brushing?
2 minutes. 2 minutes of brushing. You on a music, you hear it, you start and you finish it. You should, what you have to keep in mind, see, morning nobody is that conscious. What you have to keep in mind, you are brushing all over the mouth, starting from this side to this side. All the surfaces of your tooth, the occlusal surface means the top surface what we chew, The buccal surface, the outside surface, the lingual surface means the inside surface, all upper jaw, lower jaw, and definitely we should try to keep it in a circular motion or swipe like this swipe. So from gums to tooth, or from for a lower arch gums to tooth like this. So this is the way of brushing. Overall, you should take care that every teeth is brushed properly. Lower mandible, you can upright the brush, and you can upright this brush like this and then clean.
Okay. Inside and outside.
Inside and out. Outside you can brush. Because this area has got a lot of salivary glands. So most of the plaque and calculus develop in these areas.
Right.
So you need to clean. And the brush should reach your last teeth. If any brush, as you have come to the toothpaste, the brush also is important. A good handle is important. Shorter head size is important, because any brush should reach your posterior most teeth. That is more important because of your cheeks, chubbiness and all.
Right.
So it should, you can use a baby toothbrush if it is not reaching a normal brush. If you are not able to clean, you can use a baby toothbrush. Any brush which is good for you, any brush which is reaching which is cleaning all the teeth is good for you. There is no brand name fascination. Only thing you have to see is the head size is small, the bristles is soft bristles or super soft bristles if recommended by doctor, not the hard one. Hard one can be used for cleaning shoes. It is not for tooths. Small head bristles, silicone bristles, very good company. Any toothpaste, any brush which is 40-45 rupees is good enough. So you should know, if you go to a shopping complex, which brand and which brush and which toothpaste to pick from.
Right. And last question would be one way to immediately remove bad breath.
See, bad breath, what I recommend is, as you've asked, immediate, I will answer to that also. But what I recommend is early diagnosis. You should visit a dentist every 6 months. May you have problem, you don't have problem, whatever it is. And oral prophylaxis or scaling and polishing is a regular procedure which is done with ultrasonic vibrations and water jet. Simply water jet and ultrasonic vibrations. This is a regular procedure which is recommended. You can get the... So why bad breath is more important? If you ask me why bad breath can cause because of deposits of calculus inside your mouth. Your tongue cleaning is important to remove the bad breath. Bacteria over the tongue is... or you're getting it from the gut. These are few causes of the bad breath: gut bacteria, tongue bacteria, or the oral bacteria. And few cases where hospitalization, then it comes from the airway or lungs post hospitalization. So that is a very rare category. But how the treatment, if it is a gut problem, you need to visit a gastroenterologist or take some PPIs in the morning. If it is from the tongue cleaning is very important. And if it is from the oral cavity, definitely you need to brush well, visit a dentist. Oral prophylaxis or scaling and polishing is recommended every 6 months.
Right. Okay.
It is recommended.
Great. So,
and you told the immediate remedy. So immediate remedy, what we can do is we can use mouthwashes, which gives you antibacterial effect immediately. Any food, suppose cucumber and apple cut, it is very juicy. So it has got fibers, it has got juices. So it will dissolve the bacteria. That is a good food. We can have green tea. We can rinse your mouth with green tea. It has got antibacterial properties. You can use mint and other green leaves which has got chlorophyll. Definitely that helps you in this. We can use mouthwash. You can use long, which is also an antibacterial property. And tea I told. So mouthwashes basically, and these are few tips you can say.
Right. Great. So we have this section called straight or twisted. I'll be telling you about 10 sentences. You'll just have to say whether it is straight or twisted. Straight means it's right. Twisted means it's partly right, wrong, or whatever it is. Okay. And only one word. Are you ready? Okay. Shoot. Fluoride toothpaste strengthens tooth enamel.
It's true.
You have to say straight or twisted.
Straight.
Teeth whitening will damage your teeth.
Twisted.
Mouthwash is good for teeth.
Straight.
Teeth whitening, you only need to visit the dentist if you have a problem.
This is twisted.
Brushing harder means cleaner teeth.
Twisted.
Don't brush before breakfast.
This is straight.
Candy is not harmful to teeth if brushed away immediately.
This is straight.
Sugar-free gum is as harmful as sugary gum.
No, twisted.
Dentists are making more money than doctors.
Straight.
Okay, thank you so much, doctor. It was a pleasure having you on the show and wish you all the very best.
It was my pleasure.